Hello, everybody. Welcome along. Welcome to CLS Live. This is a live stream series of broadcasts presented by the publishers of Contact Lens Spectrum. I am your host today. My name is Philip Morgan, and I join you live from a rather wet, rather windy and cold Manchester here in the United Kingdom. So welcome to you wherever you're joining us in the world. In this short run of broadcasts, what we're trying to do is cover the situation with contact lenses and contact lens prescribing around the world. Those of you who were with us last month will recall that we covered the situation in Europe, where we found and discovered interesting differences between what's happening perhaps in Northern and Western Europe compared with what's happening in Eastern Europe. Well, today we're going to be looking at contact lens prescribing across Asia. Now, of course, Asia accounts for something like 60% of the world's population, and so there is an incredible diversity of contact lens prescribing across the region. So today we're not going to have the chance to go into every country in detail, but what I do hope is that we're able to reflect a flavor, a snapshot of what's going on across Europe. Now, for those of you watching live, you have the opportunity to send comments and or questions to me and this afternoon's guest via the interface that you're watching us from. So if you'd like to send us a question, then please put that there, and I'll endeavor to get to it as we move through the next 19 minutes or so. Well, to help us understand the situation across Asia with contact lenses, I am absolutely thrilled to be joined from Singapore by a very good friend and colleague of mine, Dr. Kar-Uwe Tan. And Kar-Uwe joins us now after midnight in Singapore, so we're grateful for him for staying up late for us. Dr. Tan has had a very long and distinguished career in the contact lens industry. He's worked for both CyberVision and CooperVision in Asia. He's held academic positions both at Singapore Polytechnic and at the University of Manchester. He was the CEO of the Brian Holden Vision Institute China between 2014 and 2019, and is currently Director of Business Development for Enthalmic, which is an eye care and a research and development center based in Sydney. He has a litany of professional positions that he holds. I will mention one. He's Regional Director for Asia Pacific for the International Association of Contact Lens Educators. I can think of no one more qualified and experienced to talk about this question of the contact lens situation in Asia. So good evening to you, Kar-Uwe, and thanks for joining us very late in Singapore.
Thank you, Phil. It's my pleasure to be invited to participate in today's live stream about contact lens prescribing in Asia.
Yeah, well, my first question, Kar-Uwe, is it's a question I've asked my previous guest in this short run about actually how contact lenses are obtained by a patient or a consumer. So, you know, suppose I'm a simple, straightforward 20-year-old myope wanting contact lenses for the first time. How would I go about getting those?
Well, in Asia, it's a very diverse market. We can look at the perspective from the product registration and practitioner legislation. But in general, contact lens can be easily available from any optical practice in Asia, particularly in South Asia. But there's some extreme cases where, for example, in Japan, it's a very stringent product registration, and then contact lenses can only be prescribed by ophthalmologists. And the same go to like China. There's certain restriction on the channel of how contact lenses can be prescribed. But in countries like Malaysia, Singapore, Thailand, any teenager or young adult, if they're interested in contact lenses, they can actually walk into the optical shop, have their eye checked, contact lens fitted, and then they can just get the pair of contact lenses from there. But there's some restriction in certain area. For example, certain specific product like auto-K, it could be like treated differently, which probably I will cover separately later. But if we look at the diverse market in Asia, the most stringent market for medical device registration is like Japan, Taiwan, mainland China, and the least regulated is like Hong Kong. So generally, in Hong Kong, you can actually buy contact lenses at any optical shop, and any supplier can actually launch the product in Hong Kong at any day, any time without any registration. But having said that, there's some restriction on that practitioner. So there's certain guideline on who and how this contact lens can be prescribed. So for example, in Singapore and Malaysia, only qualified optometry can prescribe contact lenses. And there's a certain group of opticians who are qualified to do contact lens fitting. They are allowed to fit and prescribe contact lenses. But for those opticians who actually undergoing this so-called dispensing and refraction training only, they are not allowed to fit contact lenses. So that brings us to the big challenge in Asia now is actually the public awareness. So if you go to different market, the rules are different, the restriction is different. So as a consumer, they may not know who and where they should get contact lenses from. So the only way they do is actually they walk in and ask about it.
Okay, so that's interesting. So in how many markets across Asia can lenses simply be purchased from a store or a vending machine without the need for any sort of prescription? Does that exist?
Yep, that's a good question. I think generally most of the market in Asia, you can actually walk in to buy contact lenses. But in some country or some market, there's some restriction. For example, in Singapore, the Optometry and Optician Act actually only allow consumer to buy contact lenses from a qualified optometrist. So if they walk into an optical shop or optometry practice without optometrist present, they are not allowed to buy contact lenses at all, even with the prescriptions. But on the other hand, even like Taiwan, they have a very stringent and very strict product registration. But contact lenses can be easily obtained from a convenience store or even from vending machine. So there are different way that I mean there are the different angle of like looking at this one. So on one hand, the product registration could be quite stringent, but on the other hand, the availability of the product can be quite loose.
Yes. Okay. So quite variable. Well, you briefly mentioned ortho-K there. We know with myopia being more prevalent in East Asia, certainly than in perhaps other parts of the world, the West, for example, ortho-K becoming very popular. What's the situation with regulation around orthokeratology lenses?
Generally, ortho-K is still regarded as a medical device, and it needs to be registered in the market where contact lenses are to be registered. So the only exception is actually Hong Kong. Hong Kong is the least regulated market where contact lenses like soft contact lenses, ortho-K lenses can be actually launched by any supplier at any time without any regulation. But it has to be prescribed by a qualified optometry based on the local regulation. But other than Hong Kong, ortho-K generally is regarded as a medical device, but there's some unique situation. For example, in Japan, it can only be prescribed by ophthalmology, same as in Taiwan. And in mainland China, there are different category of practitioners. Those are qualified with the 5 years training. They are allowed to prescribe ortho-K, but that's on the assumption that they are working in the hospital setting or a setting where they have the medical device license. So if the optometry working in the optical practice or optical shop in China or during optical shop in China without any medical device practicing license, they are not allowed to prescribe ortho-K lenses. But if you look at Singapore and Malaysia, generally ortho-K lenses can be easily available through qualified optometry in the ordinary optometry practice. And in Thailand, it's also a very unique situation. Right now, practitioner in Thailand is very interested in like prescribe ortho-K for myopia correction as well as myopia control. However, the Thailand FDA regard this ortho-K as a medical device, and they actually limit only ophthalmology can prescribe these ortho-K lenses. So right now, there's still no ortho-K product available or registered in Thailand yet.
Okay. Sounds like a developing situation. Well, you mentioned China. Let's talk about China a bit. Of course, it's the world's most populous country. We know that the incidence of myopia is relatively high, certainly across the urban centers in China. You'd think, therefore, it's going to be an enormous market for contact lenses. What do we know about the number of contact lens wearers in China? Do you have an estimate for that?
Yeah, that's a very interesting question. In fact, that's a question that most contact lens supplier or manufacturer are trying to find out from China. Unfortunately, there's no official data available at this stage. But based on the different sources from the local professional association or the optical magazine, it's estimated that probably is between 10 million to about 25 million contact lens wearer. Why is that such a big range? Partly also because there's a mix of different modality of contact lenses available in China. It could trace back to many years ago, the conventional annually replacement lenses, up to now the commonly available daily disposable, as well as the bi-weekly lenses. However, there's some wearer that actually the compliant might not be 100%. They might purchase daily disposable lenses, but they actually wear it for like bi-weekly or monthly lenses as well. So, and there are also some part-time wearer. So if we take into consideration some of the part-time wearer and the full-time wearer, so we estimate that probably between 10 to 25 million wearer.
Yes, that's interesting. If it's somewhere in that range, that would put it approximately the same as Japan, I think, and maybe the second biggest market in the world then after the United States at this point. But obviously, because of the size of the population, potentially an enormous market in China, and somewhere we will, I think, all need to watch. Well, if we go across the Taiwan Strait, we get to Taiwan. You've mentioned Taiwan once or twice already, Ka-Ui. What I think a lot of people maybe don't appreciate, at least in my part of the world and maybe in North America, is, you know, Taiwan is a really important center for contact lens manufacture. Can you tell us a little bit about that, please?
Yes, actually, if you look at the contact lens industry globally, other than the multinational companies supplying lenses across the world, Taiwan is probably one of the markets where they actually have their own local manufacturer that actually produce lenses locally, whether it's original from the lathe cut, spin cast, and now recently with the cast molded lenses. And generally, they actually supply as an OEM or private label to many different chain store or private buying group, etc. So Taiwan has a history of the very established quality and this technology in producing soft contact lenses and supplying it to the other part of the world, but it's not under their own brand. So if I can just have a quick count, I think overall Taiwan there are about more than 10 manufacturers from the early days, or like for example Sunshine, Innova Visions, and up to now like Pega Visions, and this so-called newcomer. I think they are still going, and there's still a lot of these small company coming up in Taiwan producing these so-called OEM private label lenses. And the other point to take note is actually Taiwan is actually quite fast in catching up with the trend. So when the color lens is becoming popular, most of these local manufacturers in Taiwan, they start embarking on the color contact lenses, and they actually sell these color contact lenses in not only in Taiwan but also in mainland China, as well as South Asia, and that also follows suit by some of the manufacturers in Korea. So Korean manufacturers started later, but they actually most of them are actually on the color contact lenses as well.
Yeah, very interesting. Well, you know, you and I worked together on a long-term project on trying to understand contact lens prescribing trends, and when we look at perhaps Taiwan, we notice it's quite an outlier in terms of, you know, it has a relatively low uptake of silicone hydrogels, low number of torics, low number of multifocals, and I guess we see this in other Asian markets as well. Let's take toric lenses as an example. Why might the uptake of soft toric lenses be lower than what we see in Europe or in North America, do you think?
Yeah, that is actually a very interesting question, and in fact, that's also a challenge in most of the contact lens industry in this part of the world. Generally in Asia, other than spherical lenses, the others design like toric lenses or even multifocal lenses, the penetration is relatively very low. I think part of the reason is because these so-called like toric lenses, the fittings philosophy is like perceived to be like more complex. So practitioners probably need to like spend more time in fitting and prescribing and taking longer chair time. So that's one factor. And secondly, is also the generally toric lenses is considered higher retail price. So consumer may not be able to accept it, and then they probably compromise by using spherical lenses. But one of the other important factor is actually from the commercial point of view is because the margin. So if practitioners are to spend time on like fitting toric lenses, they probably prefer to prescribe progressive or toric spectacle lenses because that is probably easier to prescribe, and also the margin is probably better than toric contact lenses, considering the longer chair time spent on that. So I think that's a mix of the so-called factor resulting of the relatively low penetration of toric lenses, but partly also because of the clinical competency that they perceive that toric lenses is actually more difficult to fit. But if you look at the actual situations, toric lenses is actually quite straightforward. It's just a matter of like some practitioner in Asia, if they have not gone through proper contact lens training, they probably think that toric lens is much more complicated to handle.
Yeah, well, that is interesting. We've had a question come in, Kai. We talked a little earlier about the potential for China as a market, but what about India? Sachin Ambulkar has written saying, what's the potential for India in the contact lens market? Do you think? Do you have a view on that? I do know the penetration of contact lenses is low in India relative to some other countries.
Yes, actually, most of the contact lens industry are now starting to look into India market. Initially, people believe that India market could be quite low in contact lens markets, but well, on one hand, it's probably because myopia prevalence in India is relatively low, but on the other hand, it's probably because of the awareness and also the readiness to prescribe contact lenses. But we can see that India is now actually booming with emerging of many school and college of optometry, and they recently just slightly more than a year ago, India has just passed a legislation to allow optometry to have proper so-called practice guideline. They can even use diagnostic drug. So that actually put the optometry profession in India in the so-called higher level and be able to prescribe and provide this primary eye care and contact lens fitting in a more professional and higher level. So I believe that in the very near future, contact lens revenue or market in India will be going up with the so-called availability of product and also the readiness of the practitioner to prescribe contact lenses.
Yeah, I would agree. Optometry is gaining strength in India with the recent legislation advances to our colleagues there. The level of education across the optometry schools in India is very high. And of course, with a population, once again, more than 1 billion people, you would think, again, the likelihood of a strong market for contact lenses in the coming years seems quite possible. So we will we'll watch that with great interest.
I probably can add a bit remark about India. We can see that the auto care demand is also increasing as well. Even though myopia prevalence is relatively low, but we can see that in certain areas, there are some practitioners actually looking for a way to how to prescribe auto care lenses, not only for vision correction, but also for myopia control. So in the next couple of years, we can see that there could be trending up in the contact lens demand in India.
Yeah. Okay. We'll keep an eye out for that. We need to start to bring things to a close here. A question I've been asking all my guests actually is, what part of contact lenses or contact lens practice do you feel is important, but perhaps we don't pay enough attention to? What do you think there?
I think in Asia, probably practitioners perceive contact lens fitting as a complex process. In fact, it's not. Contact lens fitting is actually as simple as like doing refraction. If they can handle refraction, probably they can easily handling this contact lens fitting. And so if they can master and understand the so-called overall procedure in the contact lens fitting and including the aftercare, I believe that they should be able to benefit more from this contact lens prescribing to their patient. At least to offer another option to their patient. Particularly if you look at the contact lens wearer in the Asia now, those who have been wearing lenses for years, they will not go back to spectacle lenses. So it's time to actually consider not only toric lenses, but also multifocal contact lenses that can benefit those existing contact lens wearers. Yeah.
Okay. Well, that's a great message for us to finish on. Kari, thank you again. I'm going to bring us to a close, but I very much appreciate you joining us today to share your great expertise about what's happening across Asia. And I hope that, as everybody watching live or the recorded version of this, perhaps hears the insights from around the world, maybe will get excited or a little bit inspired to bring the benefits of contact lenses to a greater number of patients. Well, we've covered Europe, we've covered Asia, and next month we'll be covering Latin America. So I look forward to an interesting discussion here on CLS Live in December. Please do watch out for earlier episodes of CLS Live on the Contact Lens Spectrum page on Facebook, or indeed at clspectrum.com. Transcripts of what we discuss on each of these broadcasts are available in the printed version of Spectrum, so watch out for that. And I look forward to convening in December. Now, for those of you who are watching live or even in the next day or so, I want to wish you a happy Thanksgiving for Thursday. And on Friday of this week, for those of you watching live at 2 p.m. Eastern, do watch out for the big match, the big football game, the big soccer match. It's England versus the United States in the World Cup. And I have a brother in the US, so we will be watching that very closely. I'll bring us to a close. Thanks for watching. Look forward to seeing you all in December, and good afternoon from Manchester.
Thank you, Phil. Thank you all.